Hello, I'm Sean Gerstenberger, Dean of the UNLV School of Public Health. And on behalf of UNLV and the Southern Nevada Health District, I would like to invite you to our panel discussion today on COVID-19, featuring several of our local public health experts. Before we begin, I would like to thank UNLV, UNLV-TV, and the Greenspun College of Urban Affairs for helping produce this event. I would also like to thank some of our broadcast partners. That includes Vegas PBS, Cox Communications, Clark County Television, the Las Vegas Review-Journal, and we thank them for assisting us as well. So Nevada has been impacted significantly by the coronavirus over the last year, as well as others in our local community and our nation. We've taken some proactive responses under the direction of our governor to try and prevent the spread of this virus. So first, we have transitioned our schools, our colleges, and our universities to online education. We've told all of our non-essential businesses to close, and of course, we've been directed to stay home for Nevada. And these are really important things under the direction of our governor. So Nevada now, with this heightened level of public health awareness here and across the nation, now more than ever, we need to effectively communicate accurate, scientifically based information to the public in a way that they can use and they can apply. And that is our goal here today. So to accomplish that task, we have a panel of experts, and we will be discussing several different areas. First is general information about infectious diseases and how they spread. Second, we're going to discuss the local, state, and federal responses to this coronavirus pandemic. Then we'll talk about some of the public health prevention practices, but most importantly, why they work. And then finally, we will talk about what you can do to be safe while at home. So with that, I would like to go ahead and introduce our panelists that we will be discussing these topics with today. So first, I would like to introduce Dr. Francisco C. Dr. C is the chair of the Department of Environmental and Occupational Health here at the University of Nevada, Las Vegas in the School of Public Health. He has over 30 years experience with infectious diseases, and prior to coming to UNLV, he has significant federal experience where he worked at the Centers for Disease Control and Prevention, and he worked in 2003 on the SARS outbreak investigation. Thank you for joining us, Dr. C. Second, it's my pleasure to introduce Dr. Brian Labus. Dr. Labus is an assistant professor of epidemiology and biostatistics at the UNLV School of Public Health. He is an infectious disease epidemiologist, and prior to coming to UNLV, he was the senior epidemiologist at the Southern Nevada Health District, where he has tremendous experience also working with SARS, hepatitis, and some other local outbreaks. Thank you for joining us today, Dr. Labus. And finally, I'd like to introduce to you Dr. Vit Kraushaar. Dr. Kraushaar is the medical investigator at the Southern Nevada Health District. He is also an emergency physician, and so he has tremendous experience in that area, and he comes from us to the Office of Epidemiology and Disease Surveillance, and I think he'll be bringing us a unique local perspective today. So with that, I'd like to start with a few questions for each of you. So there's a lot of things that make us sick. And so a lot of those can be bacterial or they can be viral. Could you talk to us a little bit, maybe Dr. C, about the difference between a bacteria and a virus and how they make us sick?
Yeah, bacteria are cellular organisms, and they grow inside the body, and some of them are good and bad. But viruses, they don't grow outside the body. They could stay there for a few hours, but they need to get inside the body and inside a cell. Once they're inside the cell, they could multiply. So for the respiratory viruses that we're dealing now, like coronavirus, they're easier to spread because they're airborne and they need to get through your nasal passages or your mouth or your eyes. That's why we want to make sure that people don't touch their face and wash their hands as much as possible. So that's the basic difference between viruses and bacteria.
Okay. So can those viruses then survive outside of the body? Do they multiply outside of the body?
They don't multiply outside the body. They could stay outside the body for several hours. I think studies have shown that plastic could be where they could stay for a longer period of time. But eventually they'll die because they don't multiply outside the body.
Okay. So we know that we're most interested, of course, in the coronavirus itself, but the coronavirus isn't just one. There's a whole series of coronaviruses. Could you tell us a little bit about the differences between those coronaviruses and kind of what makes this one unique? Dr. Labus?
So the coronaviruses are a family of viruses. We keep calling this one coronavirus, but it is one specific type of coronavirus. There are 4 coronaviruses that circulate every single year, and they cause the common cold. They're one of the causes of respiratory disease that we see every single year in the community. So we've all been infected by them in our lives. They're something that we deal with on a regular basis. We've had 3 different coronaviruses that have a much more serious disease. We had SARS in 2003. We have Middle East Respiratory Syndrome, which has been going on the last few years. And we have this current virus that causes the disease, COVID-19. So it's a large family of virus. We conveniently just call them coronaviruses right now. We're talking about one specific type of coronavirus that's just emerged in human populations.
Interesting. So one of the things we're worried about is that we get exposed to this virus. So could you tell us a little bit about how do people get exposed to viruses? How do we expose each other, and how do we kind of spread them around? Dr. Kraushaar, do you mind starting on that?
Sure. So different viruses have different mechanisms of spread. For this coronavirus, it's spread, or it's believed to be spread mostly through the respiratory route. So someone coughs or sneezes, a large number of large droplets are spread in the air in close proximity to where you're coughing or sneezing. And then someone else will inhale those particles, or those particles will contaminate a surface. Someone else will touch that surface and then rub their nose or their mouth and inoculate themselves. So there's some controversy about whether this virus is also spread through aerosols, which are very small particles that stay in the air for a longer period of time. It's suspected that that doesn't play a large role in transmission, but in certain settings like healthcare settings where people do procedures which can aerosolize particles, for example, when you're giving someone a nebulizer treatment or something like that, then it's more likely to spread in that sort of setting. But for the most part, we're talking about the large droplets. For example, when we've seen that graphic of someone sneezing and there's a black background and you see all those large droplets, and that's kind of what we're talking about for COVID-19.
Excellent. So when those droplets get sneezed out, so how do they actually get, obviously they go on to the next person, but then how do they infect that next person? How does that happen?
So the virus is present in those large droplets, and those droplets need to be exposed to or the virus needs to gain entry into your mucous membranes. So as Dr. C said, through the eyes or the nose or the mouth. And so basically, you're inhaling those particles, or you're touching something and then you're rubbing your face, you're rubbing your nose, and the virus gains entry. And it's not until the virus gains entry into your cells that it starts to replicate.
Excellent.
So the major mode of transmission is really airborne, so when you cough or sneeze, the farthest they could go is about 2 meters. That's why we're observing the 2 meter or 6 feet distance, social distancing, because that's how far the virus could travel. And so, but eventually they'll drop down because of gravity. But and then they could also drop around when you touch your mouth when you're coughing or sneezing. Then they could survive in some inanimate object for a few hours. So that's why it's very important to keep on washing your hands to prevent the spread of the virus.
Sure. One of the questions that I get asked a lot is can I get it from food? And so, Dr. Labus, would you like to maybe address that question?
Sure. This is not a disease that is spread through food. It's not something that you're going to eat and will cause disease that way. So you really don't need to be concerned about the foods that you're bringing into your house, whether they're from the grocery store or from a restaurant. The concern is really interaction with others. Because it's spreading through the air, if the person delivering your food coughs or sneezes on you, that's where the risk of disease is going to be, but it's not the foods themselves. So there's really no reason to change our eating behaviors, because that's not a way to get this particular disease.
Okay, so one of the things we hear a lot in the news recently too is that there's a lot of susceptible populations. So first, maybe you could tell us kind of who's susceptible to this. One of the things we like to do is, if we know who's the most susceptible, who has the worst response to that if we protect them, we try to protect everybody. So who are some of the groups that might be the most susceptible to this?
So in terms of getting the disease, basically anybody breathing is going to be potentially exposed to this disease. So it doesn't matter whether you're young or old, anybody can get this particular disease. The thing that we're concerned about is the way different people react to it. As you get older, your immune system gets a little bit weaker. So that's why we see people in the older age groups more likely to have a serious disease, more likely to need hospitalization, and also more likely to die, unfortunately. And the same is true for underlying health conditions. So if you have certain conditions that make your immune system a bit weaker, if you have uncontrolled diabetes, things like that, that can really lead to immune problems, and that's going to put you at higher risk. And if you have lung damage from COPD, you're a smoker, things like that, those types of things cause physical damage to the body, which may make it a little easier for the virus to get in, but it's a lot tougher for your body to deal with that. If it's harder for you to breathe on a normal basis, once you get infected, it's going to cause more serious problems.
So why should young people care, right? We always talk about the elderly and the most sensitive, but why should the young people be concerned about this as well?
So everybody can get this. That's, I think, the most important message here is it doesn't matter what age you are, everybody can be infected. While young people aren't likely to die from it, they can take it home and give it to those family members who are older and have those immunocompromising conditions. So even if it isn't going to be a life-threatening illness for you, it could still be a problem for the people that you care about.
Dr. Z, did you want to add something there?
I think that's the main point, that it's a novel coronavirus. That means it's a new virus. None of us has been exposed to it, so none of us has immunity to it. So all of us are susceptible to this virus. But the older people tend to have lower immunity, so they would be more susceptible compared to the younger people. But everybody's susceptible to it. We just react differently to it.
I'd also like to say, younger people may think that their risk is low, and the risk of having a severe illness is low, but it's not zero. So even if you're thinking of this from a purely selfish perspective, just what's going to happen to me, even if you're in your 20s, it is still possible to die from this disease. Your chances are smaller than if you're elderly or if you are immune compromised, but your chance is not zero. So from both a public health perspective and from your own perspective, it's important that we do what we can to prevent the spread of this disease.
Well, it's been helpful talking a little bit about the disease and how it spreads and the virus, how it spreads and how it works. But I want to change gears a little bit and talk a little bit about our local kind of federal and state responses to this. But before I do that, there's a couple terms that seem to get thrown around kind of universally, and I want to see if you could tell us maybe the difference between those. We've heard the term outbreak. We've heard the term epidemic, we've heard the term pandemic. Could you tell us maybe, Dr. Labus, again, what is the difference between those three and why is that important?
So when we talk about an outbreak of disease, we are seeing more disease than would be expected in a population at a given time. For something like this, it's a brand new disease, so we expect no cases of this. So as soon as we start to see transmission in a community, that's basically considered an outbreak. It basically means the same thing as epidemic. The terms are pretty much interchangeable, and you can use them interchangeably without any problems. Sometimes people refer to outbreaks just being a smaller geographic group or one school or one household, but it basically just means there's more disease than normal. Pandemic is when that outbreak spreads across borders. So if we see international spread, it's just an outbreak at a large level. So a pandemic doesn't mean that the disease is any worse than you would find in an outbreak. It just means that it's found in a lot more places. So what we're talking about is just the geographic distribution of that particular disease.
So we know that obviously this is spread pretty much worldwide, and one of the things we would expect is that everyone would be kind of responding in the same way, having the same message, whether they're a state, local, and federal government, but that doesn't seem to be the case. Could you tell us a little bit about how different governments, regions, areas respond to COVID-19 and why they're not all the same?
I think important thing to note is the level you're working with. So we expect the federal government to be the one that coordinates all the activities, plus the facilitation and also the funding. And then the local governments, state, city, local, community, county level are the ones that implement the prevention measures. So it's a group and united front of way to work together on this one.
So we see that from kind of the federal level, which is a great perspective. What about a little more on the kind of local or state levels?
Well, when we're talking about response to some sort of problem like this in our community, we have to recognize that every community is unique. They have their own resources and they have their own challenges. So the way we respond to it in Las Vegas isn't going to be the same response that's appropriate in Elko or in Carson City or anywhere else in Nevada. It's based on what's happening in your local community. So even though the whole world is dealing with this, it takes on the unique flavor of wherever it's spreading. So we have to build our responses around that and think about what we can do locally to stop it. The recommendations that we give are Nevada specific, but then beyond that we have to think about what does that mean exactly for Clark County, because we're not the same as other places in our state.
Mm-hmm. So one of the other terms that we've heard used in our state is that we've declared a state of emergency. So when you hear that word emergency, everybody kind of panics. What does it really mean to declare a state of emergency?
So a state of emergency is like a public declaration that allows for the mobilization of resources. So the fact that Governor Sisolak declared a state of emergency for Nevada allows us to adjust our response, perhaps to, for things like allocation of resources and licensing and things like that. It allows us to tailor our response and not just to go through our usual mechanisms. So sometimes in a situation such as this, we want to mobilize and act very quickly. Sometimes going through the usual sort of more bureaucratic channels is not ideal. And so state of emergency really allows us to act in the way we need to act in an emergency.
At a national level, then the president declared a national emergency to alert Congress that we need funding to be allocated to different communities in our country. So then Congress would meet, and that's what they did, and they started to fund, provide the funding for this epidemic.
So again, I want to switch gears a little bit. We all know we've been told to do a lot of things, right? You're supposed to wash your hands, you're supposed to clean surfaces, but I want to look at and see when we're doing that we're doing it correctly. So can we start with washing of hands, right? We all know we're supposed to wash our hands, but we need to know how to do it correctly. So what are we doing wrong when we're washing our hands incorrectly?
So the challenges with hand washing are either not doing it long enough or not being thorough in the process. When you're washing your hands, it needs to happen for 20 seconds because the whole goal of washing your hands is to remove whatever viruses are on your hands and flush them down the drain. So you're physically removing them. And as part of that, you want to make sure you're covering every nook and cranny of your hands. You're not just rubbing a few parts of the hands and missing others, because that's not going to remove the virus. So you have to do it long enough. Obviously, you have to use soap and water. And you want to be very thorough to make sure you're removing as much virus as possible from your hands.
Anybody else like to add to that?
Yeah, I think just to reiterate what Dr. Labus said, I think if you've ever watched like people scrubbing in for surgery and how surgeons are meticulous in washing their hands, and they get all the surfaces, the fronts, the backs, the between their fingers, the fingertips, their thumbs, and I think when you see in ordinary life, I think people, sometimes they just like rub their fingertips together, but this is, a situation because we're trying to reduce the amount of virus on our hands, it pays to be thorough.
So one of the things that happens is we have public restrooms and public bathrooms, and we try and go in there and wash our hands. We have all the automated soap dispensers and automated water. But talk about what things people do wrong when they wash their hands in public areas, especially if they have to turn the faucet on or off, that not everything is automatic like we have at home.
Yeah, I think especially when people are using public restrooms and things like that, I think the places where we're most likely to recontaminate our hands after washing is probably the faucet and then the door on the way out. So most people, you use your hand to turn on the faucet, and then you wash your hands really thoroughly, but if you use your hand to turn off the faucet, then you're recontaminating yourself. So and same goes with when you're walking out the door. If you're using the door handle on the way out, you're recontaminating yourself. So one of the strategies to help with this is that after you wash your hands, Take a paper towel, use that to turn off the faucet. Use another paper towel to open the door. And then it's important to have things like no touch trash receptacles. So as you're on your way out and you're using a paper towel for the door, you can throw it in the trash can without having to stick your hand through a flap or something like that.
So we need a little strategy, right, when we go in the bathroom to make sure that the paper towel dispensers aren't being retouched and the door handles and faucets. So what about anything you want to add, Dr. Labus?
You can't just think about yourself washing the hands. You have to think about the person in front of you. Maybe they didn't wash their hands. Maybe they were touching all those surfaces before you did. So even if you're very meticulous about things, you're basically picking up whatever the previous person left on all those surfaces, almost like you didn't wash your hands in the first place.
So obviously we use soap. There's 1,000 different kinds out there, right? So we have antibacterial soaps, and we have the hard soaps and the liquid soaps. Are any of these recommended or better, or what's the common knowledge that we need to know about soap? What soap should we be using?
Well, when it comes to soap and viruses, soap is soap. It doesn't matter what sort of fancy additives or perfumes or anything are in there. Soap is going to be effective because it physically helps you remove those things from your hands. Antibacterial soap doesn't mean anything because we're not talking about a bacteria, we're talking about a virus. So even the cheapest basic bar of soap is going to work to wash your hands. You don't have to do anything special. You don't have to spend a lot of money. Soap is equally effective in washing your hands.
Excellent. So the other thing that we're hearing all over the news is that we should be using hand sanitizers. And so I know they're a little difficult to find right now, but what and why do we use these? So again, we know we're supposed to be using, but I want to know why we're using. What's the purpose of using hand sanitizer?
In a situation where you have no access to soap and water, then you have to use hand sanitizers. But you make sure that the sanitizer have at least 70% alcohol to be effective in killing the virus.
Okay.
The whole idea of hand sanitizers is they developed them for use in medical settings between hand washing, where you didn't have the ability to wash your hands constantly, because that can be very taxing on the skin as well. So that's a challenge in medical settings where you need to wash your hands all the time. If your hands are visibly soiled, though, the sanitizer won't work. If you have stuff on your hands, the alcohol can't get through to kill whatever's in there. So with the hand sanitizer, you're basically trying to kill those viruses, but you shouldn't rely exclusively on the hand sanitizer. It's a nice thing to do when you don't have easy access to soap and water. You can use it between hand washing, but it shouldn't replace hand washing.
I think at the end of the day, there's no substitute for soap and water. Hand sanitizer buys you a little more time, but we all know that in our normal lives, we can't have constantly clean hands. We're constantly touching things. We're opening up doors. So the last step I think that's helpful is just not touching your face. So if you have dirty hands and you touch your face, that's how you get the virus into your nose or your mouth. So even if you're in a situation where you don't have soap or you don't have hand sanitizer, then don't touch your face.
Don't touch your face. So like the soap, we talked about this 20-second hand washing technique. Is there anything special we need to do with hand sanitizer? Is there anything we need to do that we're unaware of, or is that not the case?
So put the hand sanitizer on, rub it until it dries. Don't wipe it off on a towel or something else. It has to basically have enough time in contact with the virus to kill it. So you don't want to be wiping it off. You want to leave it on there and keep rubbing your hands until it evaporates, and that's the amount of time you should use that sanitizer.
So one of the other prevention techniques that we've been told to do is to regularly clean surfaces, which is generally a good idea anyway, to clean surfaces. But when we're cleaning, we're now thinking about this coronavirus. So tell us a little bit about how and why we might clean a surface. Dr. Kraushaar?
So the idea is the coronavirus can remain viable on a surface for a certain period of time. And we've seen different estimates based on SARS and MERS and other coronaviruses, and these estimates can be from hours to potentially even days. So the idea is that the surfaces that you're most likely to touch, those should be the ones that we disinfect on a regular basis. And so you're trying to basically inactivate or kill the virus on these surfaces so that people who touch it aren't then able to infect themselves. So high-touch surfaces are things like anything with a button, elevator buttons, door handles, handrails. At home, phones are one of the most common high-touch surfaces. We're constantly touching it throughout the day. And so this is one area that I think most people probably haven't built this into their routine. So I know this has been sort of a change for me. So when I go home, I'm disinfecting my phone, my keys, to try and make sure that whatever I'm bringing from outside the home is not going into my home.
Yeah. Any other surfaces or areas that people would like to alert us about to make sure we're cleaning on a regular basis?
I think it's the supply. Since people complain about running out of supplies, I think you can do your own solution at home. For example, you can put 1 cup of bleach plus 9 cups of water and mix them. Those are simple solutions that you can use for cleaning surfaces, table, chairs, your television, anything that inanimate object that you touch frequently. So you can have your homemade type of chemicals that you could use to clean as frequently as possible.
And I would think about in your home, what do you really need to clean? So if you're coming from outside, if you're bringing things in, that's how the virus is introduced. If other people come in, or if you're in common areas, that's how a virus can be left on a surface. But if you live alone, wiping down all the surfaces in your house on a regular basis really isn't going to do anything to protect you, because you're the only one that could contaminate them. So you need to be realistic about what type of surfaces you need to clean. But if you don't leave your house for several days and nobody's come in, it's not like the virus would be introduced, and cleaning isn't going to provide really any extra protection in that case.
Right. We want to make sure not to get that all over our food as well, too, right? Because it's cleaning agents and things, so we want to be careful with that.
I know a lot of people are concerned about products coming from outside, so they're wiping down cans and bottles and boxes and things like that. But you have to be careful with the chemicals you use around your food, because a lot of those are fine for surfaces, but not something you want to eat.
Right. So another one of the prevention techniques that we've heard about is trying to sneeze or cough correctly, right, if there is such a thing. It's almost alarming now when we hear somebody cough or sneeze, everybody looks. So could you tell us a little bit about what's the right way to sneeze or the right way to cough? I know that sounds kind of strange, but Dr. Kraushaar, do you mind?
Sure. So basically, your strategy is when you're coughing or sneezing, you don't want all those particles to be spread everywhere in that 6-foot radius. And so the ways you do that are things like sneezing to a Kleenex. So you sneeze into a tissue and you have it against your mouth before you sneeze, then most of those particles are caught in the Kleenex, and then throwing that Kleenex away and washing your hands. So if you don't have a tissue with you, then sneezing into the crook of your elbow is another good strategy. We don't want people sneezing to their hands, because sure, you're not going to spread those particles everywhere, but then you're going to touch stuff and you're going to contaminate things. So you're much less likely to, touch something with the inside of your elbow, and so that's the strategy behind that.
So when you sneeze into that Kleenex, you said something in there that you want to make sure and throw that away. So some people have handkerchiefs, they have Kleenexes, they have other things, or if you've coughed into your arm. So then what do we need to do with those things? Do we launder them? Do we throw them away? We don't want to, put them up our sleeve or in our pocket, right, because they're full of viruses. So what's your recommendation? What do we do with those things? Dr. Labus, do you mind?
Well, if it's a disposable thing like a tissue, throw it away. Don't reuse it. Those things should be discarded. This is really a bad time to use a handkerchief or something like that. Use disposable tissues that can be thrown away. When it comes to your clothes, you really don't need to do anything special. Just wash them like you normally would. Dry them on the highest setting that's recommended, and that's really all you need to consider when you're thinking about fabrics that you may have sneezed in or could have some viral particles on them.
Okay. So part of the sneezing is, as you mentioned, trying to reduce the virus and those droplets from going all over the place. And one way you can do that is with a mask. So there seems to be a lot of misinformation out there about masks. There's people wearing them all over the place, to the store, to the supermarket, at home, hospital settings. Could you tell me about when and how we should wear a mask and when it's the most effective time to do that?
So masks, so the basic surgical mask, or so masks that don't filter really fine particles like the N95 mask. So the basic surgical mask, the biggest effect of that is just stopping the spread of the large droplets, as you said. And so it's not really, for those masks, it's not really about preventing you from getting infected, it's preventing the wearer from infecting others. And so that's really the biggest value of those masks. In a healthcare setting, the situation is slightly different. Physicians and nurses and healthcare providers are getting in really close contact with patients who are sick. They may be performing procedures that are likely to aerosolize the particles. For example, if someone is intubating someone, like putting a breathing tube when someone is having a real difficult time breathing, that can actually aerosolize particles so that they're really small particles. And in that setting, the N95 becomes critical to help protect the healthcare provider. But for someone who's just walking around in the community, there's very minimal protection that something like that would provide them, because you're not really being bombarded with these particles all the time. Mm-hmm. So just to summarize, the main protection for most people for a mask is preventing you from infecting others. Okay.
And I would add that in a healthcare setting, when you're using those N95 masks, it's not as simple as just handing out a bunch of masks to the staff. There's a whole process that goes along with it to make sure the mask is the right shape for your face, that it seals around your mouth, and that you know how to take it off. If you have a mask that's doing a great job of filtering out the virus, and the first thing you do is grab it with your hands, now that's on your hands. So it's not as simple as just putting on the mask. There's a whole process that goes on around it. So just buying N95 masks isn't necessarily going to provide the protection you think it will, because they have to be used and fitted properly. It is a piece of personal protective equipment, and it's really tailored to an individual.
I think it's also important to realize, if you just say you are someone who had a stash of masks at home, because you're wearing a mask doesn't mean you no longer have to take those other steps. You still need to avoid rubbing your eyes. You still need to wash your hands, things like that. So we don't want people to have a false sense of security just because they're wearing like a surgical mask. It may be helpful in some situations, but you still need to take those other precautions.
Yeah, it's good to know that all these things work in concert, right? The washing the hands, the cleaning the surface, the masks, and all those. So we do see the masks that everybody's wearing, the cloth masks. Some of those are disposable. Obviously, we've already talked, you should take those off and throw them away. But what about the cloth ones, right? Those are designed to be reused. You mentioned you don't want to just kind of take those off and roll them up and stick them in your pocket. What should we do with those once we've worn them and once we want to kind of launder them or clean them?
We would still wash them away just like you would any other fabric. So wash them on a hot temperature, dry them on a hot temperature. But really you have to think about what happens between when you're washing it. If you have that mask and it's filtering out particles and you're touching it, think of the furnace filter you change out in your house when it gets dirty. The same sort of thing happens with whatever that mask is filtering out. Even though you can't see it, all those particles are on the outside of that mask. So you still just can't take it off, put it back on repeatedly over the course of the day without thinking about how you're touching whatever that mask was supposed to filter out.
So we right now have a shortage of supplies, including masks, because in the worried well, people are using it a lot, and there should be a priority for it because, as mentioned by other speakers here, the highest priority is for medical workers to use them, and also patients who are infected. So those who are not infected, the likelihood of you getting infected from others is less. So you should give the medical workers and the infected patient more opportunity to use them rather than you using it because you're not infected, but you're just worried about it.
Right. Well, and one of the ideas here is that obviously we're stopping those particles from moving, but another thing that we can do, and another prevention technique promoted by public health, has been this new word that we all got to talk about, or new words of social distancing. But there's a couple of words in there we talk about. We've talked about quarantine, self-quarantine, isolation, social distancing. Could you tell us what the difference is between those, and then again, what's the purpose of doing that?
So basically all of those terms are ways that we can physically separate ourselves from others. Isolation's a medical term we've used quite extensively. It talks about what to do if a person is sick. So if someone is sick, they need to be separated from other people. So that maybe staying in a separate room or special rooms in hospitals with certain kinds of airflow that keep you from spreading your disease to other people. The idea of quarantine is we're keeping you away from other people, but not because you're sick, but because you've been exposed to somebody and you could become sick. We're concerned that there is some potential for spread before your symptoms start. So this way, if you're quarantined from the time you're exposed and you do get sick, you won't put other people at risk. The idea of self-quarantine is just doing it at home. We're asking you to do it rather than having some legal intervention or a legal requirement that you do so. But the basic idea is keeping you away from other people so that you don't develop disease. Social distancing is just the broad idea of putting physical separation between you and others. If the virus can spread about 6 feet when you're coughing or sneezing, you want to be beyond that. So you don't want to be lining up close to people if you're in a store. That's why we're asking people to stay home, because it's going to minimize contact between you and other people and stop you as a link in that chain of disease transmission in the community.
That's good information. So I know you mentioned a little bit now, what do I do if I get sick? So if you're at home and you're starting to feel sick, there's a lot of information out there, but what are we supposed to do? What do you tell people if I'm not feeling well? Do we want them to go to the ER? Do they go to the doctor? What are they supposed to do?
Well, one of the difficult things about this disease is that it can start off very mild, and many people may have mild symptoms throughout their whole course. So, if you feel like you are coming down with a cold or having flu-like symptoms, the first step is to please don't go to work. A lot of people are staying home, but some people are still going to work. So one of the most important things is please stay at home. This is a time where, because these symptoms can overlap with like common cold symptoms, if you start to feel sick, also practice social distancing from your family members. So we want to really try not to transmit this to other people. Now, we know that testing has been an issue nationwide. So in an ideal situation, anyone who has any cold symptoms would get tested. And unfortunately, that's not really feasible right now. But what people can do is they can reach out to their healthcare provider, figure out if they have symptoms that would warrant testing, and their healthcare provider could facilitate that testing. But one thing we don't want people to do is, just say you have mild cold-like symptoms, we don't want you to rush to the hospital or to the emergency department to get tested. Right now, the hospitals and emergency departments, they're getting inundated with very sick people, and we want to conserve the resources at the hospital for people who really need emergent treatment. So people who may need oxygen, people who may need to be put on a breathing machine. And so if you have very mild symptoms and you go to the hospital, then that'll take away time and resources from other people. Now, it can be hard sometimes for people to distinguish when they need to go to the hospital or not. But I think a rule of thumb is that, if for your current symptoms, if a year ago you wouldn't have gone to the hospital for those symptoms, like you had cold symptoms, and a year ago you wouldn't have gone to the hospital for those symptoms, then I think it's appropriate to not go to the hospital at this time. Really, it's working through your primary care provider. And another thing is that there's a lot, even if people do have COVID-19, that they can do to sort of help with the symptoms. So things like fever-reducing medications and things like that will go a long way to helping you feel better and sort of managing your symptoms.
The most important thing to remember with this coronavirus epidemic is that there's a high rate of asymptomatic carrier, because people are infected, but they have no signs and symptoms of the disease. So about 80% of the people who are infected would have very mild no symptoms or mild symptoms to start. And only about 20% would have symptoms like pneumonia, and then about 10% would be hospitalized. Of those 10%, 5% would have more severe infections that really require intubation, other type of procedure. But the most important to remember is that there's a lot of people who are infected but have no symptoms. That's why we're practicing all the social distance, isolation, self-quarantine to avoid exposure. So in other words, it's very important to treat people as if they're infected and observe all the different precautionary measures.
So obviously there are a lot of people that are getting sick. Do we have anything on the horizon? Is there a cure? Is there a remedy? Is there a vaccine? And when might we expect to see that?
Well, when it comes to treatments, there's a number of different chemicals that are being tested. All sorts of different drugs are being tried right now to see what is effective against coronavirus. And these are being tried in hospital settings around the world to find something that can reduce the death rate or reduce the severity of disease. But we don't have a particular one right now that's recommended. We're also not telling anybody to self-treat with any things they may have heard about, because really there's no proof that any of these things work, and a lot of them can have dangerous side effects. So we're working on different treatments. We're just not at that point. When it comes to vaccines, the process of producing a vaccine is conceptually simple, but it takes a long time to actually test it and show that it works. You have to vaccinate a bunch of people and compare them to people who are unvaccinated to see that there's actually a difference in the development of disease. And that takes months to years. So it's going to be 12 to 18 months at least before we're having serious conversations about a vaccine being available, assuming that it actually works, and assuming that with this virus you wind up getting long-term immunity, which is also something we don't know. We don't know what happens 12 months after you're infected, if you can get infected again, or if you get it once in your life and that's it, because we haven't had more than 3 or 4 months experience with this virus, and we can't say what's going to happen a year, 2 years, 5 years down the road. So there's a lot of things we don't know, and that makes it challenging to make decisions about using a vaccine if we even had one.
Yeah, especially with viruses, it takes a long time to develop a treatment or a vaccine for viruses, because it's harder compared to bacteria, where you have antibiotics that you can use that could treat them. Important to remember is that there's no magic bullet for this one, and usually it's combination strategies. All these things that we're talking about, from hand washing to social distancing to isolation to all combination factors like this will help in stopping the epidemic. We did that with SARS in 2003, and it happened in Wuhan now. In Wuhan, China, the cases are going down now because they're doing this. And if you look at the statistics, it's maintaining at the same level in China, while the rest of the world is still going up, because we're looking for this magic bullet, but there's none. It's a combination of all these strategies that will work together.
That's, obviously why we wanted to talk a little bit about all these prevention strategies and why they're so important to implement, because they can really help slow the spread of this disease.
And I think, because things like vaccines or potential successful trials of drugs are at least months away, potentially years, this is really why some of these social distancing measures are being promoted, is because you really want to delay that peak, and you want to make that peak not as high. So fewer numbers of cases and spread out over a longer period of time, and we buy ourselves some time to do things like discovering effective vaccines.
So it's been a good discussion about all those prevention techniques, but now we want to kind of take those into the home environment. So a lot of individuals have been sent home to stay home with their families. What if you go home and one of your family members is sick and has been exposed? How do you protect them? How do you protect the other individuals in that house? And what are the practical things they can do around the house to not spread this to all members of the family?
So just like everything else we've talked about today, it's about putting a physical distance between you and other people. So you have to think about it, just the people who are generally in your home, and then there's the people caring for the sick person. So if you can put a physical distance between you and that sick person, that's going to reduce disease transmission risk. So if you have an extra room, that's where that person can stay by themselves. They have their own bathroom. That's the ideal situation. So you're physically going to separate them and have them in a room separate from everyone else. And the only person touching or being in contact with that sick person should be the caregiver. You don't want to have the elderly grandparent as the caregiver for somebody, because they're at much higher risk of a serious disease if they were to be infected. And so then you really have to start thinking about cleaning surfaces around your house, hand washing, and being very careful anytime you're having interactions with that sick person. It's ideal if you have a separate room, but we know most people don't have the ability to do that everywhere. You have potentially a lot of people living in a 1 or 2 bedroom apartment, and so it can be challenging to put that distance there. But it may be that you set up their bed kind of in the corner by an open window, have everyone kind of stay away from them, whatever it is, keeping some distance, and then pretty much not having contact with that person except for the ones who are going to be providing direct care.
I think what Dr. Labus said was exactly right. I think the the issue of air circulation is very important. I think if you are in a situation where that person doesn't have their own room or something like that, keeping windows open improves the air circulation, makes it much less likely that these particles are going to stay in the air for a longer period of time. So if we know that someone's sick at home and we know that they have COVID-19, these measures become extra important, and so people need to be much more strict about keeping that distance, about sanitizing things than just in our ordinary lives.
What about things like laundry and trash cans? And unfortunately, people are sick. There's usually a large pile of Kleenexes. How do we deal with that so that we don't expose other people? Anything different we should do there?
I think things like having the no-touch trash receptacles, so making sure that you're not having to physically use your hand to open up a trash can is important. Throwing away things like dirty Kleenexes. You want to have a situation where you're not sharing dirty utensils, so this is not the time for communal eating and sitting around the table. If someone is sick at your home, you want to make sure that they're eating in a separate location. But things like washing your dishes, the normal detergents and stuff should inactivate this virus, and same with laundering your clothes and things like that. So, but anytime you're potentially touching something that could be contaminated, you need to make sure to wash your hands afterwards.
I would say if you have gloves at home, that'd be the time to wear the gloves. If you're taking out somebody else's trash or handling soiled laundry, that's just going to provide one extra barrier between you and the contaminated material. But just because you're wearing the gloves doesn't mean you stop the hand washing. You wear the gloves in addition to the hand washing. You're trying to stop the contamination in the first place, but we still have to remember to practice good hand washing, especially in a situation like that.
And if you do have a sick person at home, this is the time where masks could be very important. So if they are having to come out of their room or their area of the house, then having them wear a mask will help to potentially prevent them from infecting others.
That's some good practical advice for folks at home, but sometimes we still have to go out, right? We run out of groceries, or we have some emergency in our house, we got to fix a leaky pipe or something. So what can and what are our businesses doing to try and help us to also follow these prevention practices that we talked about? What things have we seen, or what things should they be doing? Dr. C?
Actually, we've seen that people observe the social distancing. Like, if it's a small store, you can see that they say we allow only 2 or 3 customers at a time. Or when you go in line to pay your bill, you also observe the distance, about 6 feet away from each other. So you observe those precautions so that you don't get exposed or to other people.
Anything else we're seeing in stores?
Well, a lot of it has to do with just thinking about how you separate people physically. It can be a bit of a challenge in some of the stores, because if you go to the grocery store, there are certain products that everyone wants to purchase, and so you have people congregating around the milk or the bread or things like that. So there's not much the stores can do in those situations other than only allow one person into the store at a time, because you'll have people coming together. But you need to think ahead as an individual. Even in the ideal situation, you need to follow the rules still of staying distance from another person. You may have to wait a few seconds for the other person to walk away, but think about how you're going to come in contact with them and try to minimize it, even if the store is doing something to try and minimize the amount of times you're touching things. I've been to places where they won't touch your card. You put the card in, that's it. And they changed their practice where you normally would hand them the card and they would swipe it for you. But just little things like that minimize the amount of time you're having contact with other people and the potential for disease spread.
Yeah, I've seen them wiping down grocery carts and other things when you enter the stores too, which I think are some good practices. So with that, a lot of people are trying to avoid going outside and avoid doing things. So they're ordering all sorts of things online. So that's a group of people that we need to thank. They're working double time right now, our shipping and delivery people. So what practices have we seen in like shipping and delivery that are also trying to follow these prevention practices?
Yeah, I think you said it exactly right, that we need to be very thankful that there are people who are still working in these warehouses. They're shipping out products. There are people delivering those, so we need to definitely not take those people for granted. We are fortunate in that it's probably the easiest it's ever been to self-quarantine, because you need groceries and you can't leave, and you can just order it with a click of a button. So yeah, I mean, I think those are all very useful in our modern lives.
I think we've seen a bunch of commercials where businesses are really starting to understand this now, and they're advertising no-touch delivery. So they are happy to come to your house, leave it on the doorstep, and not have direct contact with you. So if that delivery person is bringing something up and you don't need to go out and physically take it from them or sign a receipt or something like that, let that person go back to their truck and drive off before you're going to walk outside and potentially put them at risk. They're coming in contact with hundreds or thousands of people a day, and you don't want to increase that risk for them becoming sick. So think about that delivery person and what you can do to protect them, not just the things you need to do to protect yourself from whatever disease they may be carrying as well.
Yeah, I know a lot of folks coming out, they do touchless delivery and, you know, set things on the porch and try not to have you signing on the keypad. So there's been a lot of information about that. So one of the things that we also, I think, are struggling from is there's this information overload. And every website and YouTube and place has got information about what to do about coronavirus. So could you tell us about what are some of the most credible sources, maybe from a local perspective and a federal perspective, about where people should go to make sure the information they're reading and they're getting is good, quality, accurate, scientifically based information? Dr. C, do you mind starting about some of the federal resources?
Federal level CDC website is the most credible of all in terms of prevention, but for research in terms of new medications or current vaccine development, you can go to NIH website, so cdc.gov or nih.gov. Those are very important federal resources. But academia is also a good source. So Johns Hopkins or coronavirus.jhu.edu is also a very good source of information.
And I think if you're interested in finding out what's happening at the local level, then the Southern Nevada Health District website is very useful. So there's a shortened URL for the coronavirus page. It's snhd.info/coronavirus or snhd.info/COVID-19.
And I would add, there are all sorts of reports every single day about case counts. We track the number of cases, we track the number of deaths. There's no sports on TV, so people have to follow some sort of number from day to day. Those numbers are rather complicated. So just because we saw an increase from one day to the next doesn't mean it's the end of the world. It doesn't mean that there's been a huge change in the disease. Trying to interpret those numbers is very challenging, even for those of us who are working with this every single day, because it doesn't show exactly what's happening today. It's kind of what happened a couple of weeks ago, and it's based on how many people were testing and things like that. So I would basically not follow it day by day and say, here, well, the numbers went up 2%, that means something. Well, it really doesn't. They're very difficult to interpret, and I think you're going to drive yourself nuts and freak out quite a bit if you constantly watch those numbers and try to make more sense of them than even people who deal with them every day can do.
Focus on those prevention techniques rather than watching all the numbers. So as a public health professional, one thing we promote every single day is that people try and stay healthy, right? That they eat right and that they exercise and they do all these things. That's changed a little bit too, right? Our gyms, our workout facilities, all those areas are closed. I've been getting a lot of questions about how can I stay healthy during this, and how do I do that without violating all those things we talked about earlier? So might you have any recommendations on how people can stay healthy and eat right and do the things that we want them to do every day?
Well, I think, first of all, nutrition is important. So, I mean, all the fruits and vegetables and things, we're still able to access them in stores. I think those, we want to be as healthy as possible, eating nutritious meals. We want to be getting plenty of sleep. So sleep has an important effect on your immune system. So, now is not the time to stay up all night, reading the news, even though it's very tempting. So make sure you're getting adequate sleep. I think exercise is great as long as you're doing it in such a way that you're not potentially exposing yourself to other sick people. So, if you can exercise in your home, or even if you're jogging outside, as long as you're not getting in close proximity to others, then now's the time to do it.
Dr. Labus, I know you've been interviewed a few times.
I've gotten a lot of questions about that. Can I go out running in a group of people? Well, no. The rules we have on stores or anything else in public are the same as we're going to follow for any time we're out doing an activity. And it doesn't matter what that activity is. If you're doing it with a group of people, that's a bad idea. If you're out walking by yourself, that's fine, or you and the people you live with go out together. You also have to think about how people congregate. So going to the park may be a great idea, but if everybody has that same great idea, all of a sudden you have a lot of people in that space that you normally wouldn't. So you really have to think about how you're going to physically separate yourself from other people, no matter what you're doing when you go outside, whether you're going to the store or you're going out for a jog or a bike ride or something like that. It's all about avoiding that direct contact with other people as much as possible.
Yeah, I want to follow up on that a little bit because there's just so many things about this that are happening. You know, there's dog parks, right? So now is a great time. Everybody wants to go out and walk their dogs and get their pets exercised. You know, how can we tell them to be safe there? Or people like to ride bicycles. That's another great area we hear about. How can they do those things safely? We want them to exercise, but we don't want them to cause harm.
Well, with cycling and doing individual activities like that, it's all about going by yourself or with the people you live with, not doing it as a social event as well as the exercise. And that's one of the challenges with a dog park. Yes, it's nice to let the dogs go run around, but it's a social event for the owners just as much as it is for the dogs. So again, if you have a bunch of people coming together, that's going to be a problem. And of course you want your dogs to go out and play and have fun, but that can be a bit of a challenge right now. We don't want the entire community going to one dog park because there's no way to physically separate yourself from others. Now, it's not a risk from getting a disease from the dog or anything like that. It's a risk of the other people that are all going to that same location. And especially at a dog park, there's no way to really keep your dogs apart. They're going to run up and get little scuffles and you have to go pull them apart. So that puts you at risk of being around other people, and you want to avoid that as much as possible.
Right. So one of the things that has become a little bit socially awkward is we in the United States typically greet people, right? We give them a handshake, we give them a hug, we give them a high five. How can we do that in a way that doesn't make individuals feel awkward or displaced in some way, shape, or form, but show them that really we respect them as a human and that we don't want to transmit the spread of this diseases? So how can we kind of break down that social awkwardness we get when we encounter somebody, you know, on the street or at the dog park or wherever it is?
Well, we can learn from other culture. In Japan, they bow their head. In China, they just nod their head. Or in Thailand, they would say, so a tea like this. So there are different ways of greeting people, so you don't have to really have contact with each other. But there are probably newer ways that people can do it, like, I don't know, fist pump or whatever they do it, but younger people have new ways of greeting each other nowadays.
Right. Yeah, I know when anyone approaches me and says, hey, I don't want to shake your hand because I have a cold, I usually go, well, that's pretty awesome, and thank you for respecting that and respecting my health. I do want to give you all a few minutes to just kind of wrap up and give everybody a little take-home message. And so if we don't mind, you want to start with that, Dr. Labus, some kind of parting words or words of advice for our listeners.
When you work with infectious diseases, you tend to think of the world as a chain of transmission. Everybody you come in contact with could be a source of disease for you and somebody you could spread the disease to. So really think about that, and I think the message of stay home for Nevada is very important. Staying home is going to limit that contact with others, and then those important steps you take of hand washing and all that, that's what we need to do right now to stop that chain of transmission.
For me, it's 2 points. One is there's no magic bullet, so it's a combination of strategies that we should all practice together. And the second point is looking at the social implication of this epidemic. As an Asian person, I could feel that there's an increase in anti-Chinese or anti-Asian sentiment. And I think we should avoid that because our enemy is the virus, not really the people who are infected or affected by the infection.
I think at the end of the day, this is very disruptive, but the measures we're taking now really, I think, will save lives and decrease the number of people who get infected. So it's important for us to keep on these measures.
Yeah, I think that's a great point, that, you know, an inconvenience for us could mean saving the life of somebody else and following those specific areas. Well, I do want to thank the three panelists today. I think this has been very insightful, helpful. I hope that individuals learned a little bit. I do want to thank our KUNV radio station for broadcasting this as well. And I also want to encourage you to think about how we apply all these different areas, whether they're social behavioral changes, environmental changes, healthcare changes, or based on the principles of epidemiology and biostatistics. That's what public health does. I would encourage you to check out our UNLV School of Public Health at unlv.edu/public health, and you can find more information about degrees or careers like these individuals on our panel. So thank you all very much for coming.
Thank you.
Thank you.